Hello, welcome to the parshealthTV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about best self-treatment techniques to get rid of Piriformis syndrome. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. Your piriformis is a small muscle located beneath your glutes that helps to rotate and stabilize your hips. When this muscle gets tight, overused, or irritated, it can put pressure on your sciatic nerve and cause a condition called Piriformis syndrome. In today's video, we'll look at different ways you can massage your piriformis muscle in the comfort of your home using a foam roller or a ball. We'll also share several stretches you can do to help reduce Piriformis syndrome symptoms. So, stay tuned with us. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Piriformis syndrome is a painful condition of the buttocks, though the pain can also extend down through the legs. It's an uncommon neuromuscular disorder caused by compression of the sciatic nerve or weakness of the piriformis tendon. The piriformis muscle is located in the buttocks. Much of your lower body movement depends on this muscle because it stabilizes the hips and is highly involved in thigh motion, helping to maintain balance as we walk. Because of this, Piriformis syndrome can be highly debilitating if left untreated. People with Piriformis syndrome often feel pain, numbness, or tingling in the buttocks. Sometimes, the pain can be severe along the length of the leg following the injured line of the gluteal fascia. You may notice pain while sitting, going up and down stairs, or running. The condition comprises about 5% of cases of the low back, buttock, and leg pain. It is mainly caused by overuse and childhood jumping or landing injuries to the piriformis tendon, which can cause myofascial radiating pain. Diagnosing Piriformis syndrome. There is no official way of diagnosing Piriformis syndrome aside from symptoms of pain and a history of trauma to the buttocks. Physiotherapists put you through a physical exam that uses many of the muscles central to this condition. To rule out other causes of sciatic nerve compression, we'll also do radiologic tests such as MRIs. These conditions can feel very similar to Piriformis syndrome. Treatment of Piriformis syndrome. Try to avoid positions or certain activities that trigger the pain. Rest and heat can do wonders. Work with a physical therapist to develop exercises and stretches that help balance the gluteal muscles for the weakness in the tendon. PRP therapy or trigger point injection therapy can help restore tissue integrity, alleviate the spasms, and provide relief. Growth factors in the PRP can help heal the afflicted tendon. Stem cell therapy can provide additional healing power. Massage therapy can provide significant relief to the symptoms of Piriformis syndrome. Massage can relax the piriformis and other gluteal muscles, reduce pressure on the sciatic nerve, and prevent spasms. It also releases pain-fighting endorphins, which act as natural painkillers against the pain of Piriformis syndrome. Self-massages and stretches. Before doing any stretches, you should try to release this muscle with the massage. You can use a foam roller and massage ball for this. Number 1. Foam roll the muscle. This helps release the piriformis muscle and take pressure off of the nerve. To do this, you can start by sitting on a foam roller. Cross your affected leg on top of your other knee as shown. Lean slightly towards your affected side and find a tight spot. Hold 30 seconds on the tight spot. Find another tight spot in the same area and repeat. Number 2. Using massage ball. Using a massage ball, you can trigger the muscle even more precisely. Be careful when applying pressure to not overdo it. Begin in a seated position on the ground with your knees bent. Position a massage ball under your right buttock affected area and rest your hands on the ground behind your back. Cross the left leg on top of the right leg. Find a tight spot and hold it for 30-60 seconds. Move on to the next tight spot. Number 3. Standing piriformis stretch. This helps by putting the piriformis in a nice stretched position. This stretch not only relieves piriformis muscle tension but also may take the stress off the sciatic nerve as well. To do this, place your leg on top of a tabletop as shown. If a stretch in your buttock is not felt, you can lean forward to increase the stretch. Hold 30-60 seconds and do about 2 sets on the affected legs. Number 4. Supine hip or piriformis stretch. It stretches the piriformis muscle as well as other muscles in the region, which helps take tension off of the sciatic nerve. To do this stretch, lie on your back as shown. Cross one foot over the opposite knee and keep your foot on the floor or mat. Pull the knee with the opposite hand toward the opposite shoulder. Hold 20-30 seconds. Repeat 2-3 times per side. Number 5. Pigeon Pose. Another way to stretch your hips and this buttock. To do this, position one leg in front of the other affected leg in front. Bring the outer thigh of the front leg down to the floor as much as you can. If you need to make this stretch deeper, simply lean forward a little. Hold 20-30 seconds. Repeat 2-3 times per affected side. Number 6. Side leg raise. This will help to strengthen the gluteus medius muscle, which is an important hip stabilizer. By strengthening the muscles of the hip and butt, we are able to stabilize the body better and reduce our risk of developing injuries and allow our bodies to move the active way they were intended to without pain. To do this, while lying on your side, slowly raise up your top leg to the side. Keep the knee straight, leg going up, and maintain your toes pointed forward the entire time. Keep your leg in line with your body. Aim for 10 repetitions. The bottom leg can be bent to stabilize your body. How to prevent Piriformis syndrome. Good posture and proper form during physical activities are crucial to preventing Piriformis syndrome. Make sure to always warm up before any physical activity and increase your intensity slowly. Try not to spend too much time running or exercising on hills or uneven ground. If you feel any pain, stop what you are doing and rest until the pain goes away. Massaging your piriformis muscle may help ease your Piriformis syndrome symptoms. Regular self-massage and stretches can help loosen the muscle and reduce pressure on your sciatic nerve. You can use a foam roller, tennis ball, or another similar sized ball. Massaging your piriformis muscle at home is generally safe, especially if you start gently and slowly. If you notice a worsening of your symptoms, stop immediately. If your symptoms don't get better with time, consider following up with your doctor or a physical therapist. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.